Let's see if that's better. That works. All right. Let's see if we can share our screen here. Oh, that's me. All right, perfect. Well, we're going to talk about the introduction to metabolic testing, functional and nutrition and neurology for thyroid conditions. So let's see if we can pick this up here. All right, this presentation again. This presentation is for everyone. We are not going to judge you. The fantastic thing about this presentation is there is no wrong or right question to be asking. This is about you. We're going to be talking about thyroid and the various conditions that the thyroid affects. So this, again, many of you have tried everything and some of you have tried nothing. So this presentation, we're not going to judge, but we need to address your specific concerns, and we'll be talking about that in the chat. So let's go over this first. America has a health crisis. Now, how many folks out there, I know we've got several people on the line, have been dealing with America's health crisis? Let's put this a little bit into perspective. We know America spends billions of dollars every year in healthcare. Insurance companies pay for what? Well, they pay for testing. They pay for medications. For the most part, they'll even pay for surgery. But they do not do a good job of paying for your health. Insurance is there if you fall off a roof and break something. Thank goodness you've got insurance. But insurance does not know how to handle long-term critical care issues. People that have chronic conditions like thyroid or even diabetes, or sadly things like cancer that are long-term conditions that people just are not able to recover well from. This ranks us in developing nations. We are ranked near the bottom. Yes, near the bottom when it comes to healthcare. So why is that? Well, 85% of all medical procedures and surgeries are scientifically unproven. So we're busy trying things to help people get better, but they're scientifically unproven, and they just are not working like we would hope them to work. I know many of you have been on medication, and you're suffering with side effects still, or you're still suffering with a problem that the medication was supposed to treat. For instance, some people with heart problems get liver disease because they're taking medication. So they start taking medication for liver problems, and then they have kidney issues. So one just leads to the next, and it's a vicious, never-ending cycle. 90% of all diseases prevalent today are not treatable with orthodox medical procedures. There's just no way to treat them. They try and manage it, but even that management is poor. So let's see if this sounds familiar. Some people experience severe allergic reactions. They get rashes, hive, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, or tongue, chest pain, dark urine, fever, chills, persistent sore throat, flu-like symptoms, nausea, muscle pain, tenderness or weakness, painful or frequent urination, pale stools, red, swollen, blistered, or peeling skin, severe stomach pain, diarrhea, swelling of the hands, ankles, and feet, yellowing of the eyes or skin. How many of you are experiencing these conditions even as we speak? Well, I know a lot of people are thinking, well, yes, I have thyroid diseases. This is what I see when I have a thyroid disorder. Well, the reality of this is not thyroid condition. This is the side effects of Lipitor. So people that are taking a medication to supposedly help lower their cholesterol or assist their overall health care are giving people side effects like you're experiencing now with thyroid symptoms. So this is not the answer. Well, let's talk about thyroid. Thyroid supports just about everything, and we're going to give a quick anatomy lesson. If you look at the thyroid gland, this is the front of your neck. So there's your chin. Our thyroid sits right there under the Adam's apple. For women, it's not very prominent, and for men, you're right, it's right under that Adam's apple. And it's this U-shaped gland right here. The thyroid gland supports bone metabolism, the immune system, brain and nervous system, the gastrointestinal function, liver and gallbladder, growth, sex hormones, fat burning, insulin, glucose metabolism, healthy cholesterol levels, and proper stomach acid. Every cell in your body has thyroid receptors. So some of the things that we see with thyroid symptoms are hair loss and thinning of the hair, tired and sluggishness, bowel difficulty, depression, morning headaches, weight gain, cold hands and feet, hot flashes, we know that's out there, mood swings, nervous and emotional issues, insomnia, night sweats. Now, the standard medical treatment is to burn out the thyroid with hormone replacement, basically to take the hormone replacement and stop the thyroid from working at all. Now, this is basically based on a 50-year-old model. This is what they've been doing 50 years ago, and this is what they're doing now. This is not the answer to treating thyroid issues. Now, thyroid metabolism, we need to talk about how it works. Basically, the way the thyroid ends up working is that the hypothalamus, which is in the brain, sends TRH to the pituitary gland. Now, TRH is thyroid releasing hormone. It basically starts this whole process. Now, the pituitary gland then releases TSH to stimulate the thyroid. Now, most people with thyroid problems know about TSH. So this is what kicks the thyroid into activation. Now, the thyroid, once it receives that TSH, it stimulates TPO to create T4 and T3. T4 and T3 are the end hormones that the thyroid creates, and that's what every cell of the body uses. In fact, T3 is the active form of this, and it's very important that the body get T3. If we do not have T3, we have all kinds of symptoms, and the body just doesn't work like it's supposed to. So let's talk a little more on how that actually works. See, the thyroid again, thyroid will come and it produces T4 and T3. Now, 93% of what the thyroid makes is T4. Only 7% is T3. Now, 7% is the active form of T3, and that's very important because that's what the body uses. Well, as soon as that T3 is released, the body will usually burn that up and use that for normal activities, which means the rest of the body has no access to that T3. So what the body does is it's smart and produces T4, which is inactive. And an inactive T4 can be transported through the body. So what happens is that T4 goes through the body and it's transferred down to the liver. In fact, 60% of T4 is converted to T3 through the liver. And the way that goes is 20% goes to the peripheral tissues, 20% ends up becoming inactive or reverse T3, and finally another 20% stays inactive T4 and then goes off into the gut. The gut converts that active T3 or converts the inactive T3 into active T3 where the body can use it. So 20% of the active T3 goes to the peripheral tissues, and then another 20% goes and converts in the gut. So this is how we get that free T3. Now, anywhere along this pathway, that T4 can break down or it cannot be turned into T3 correctly, When that occurs, we have an issue with free T3. So most people are talking about only 2 tests. They're talking about TSH at the beginning and this free T3 at the end. That means there's this whole pathway that we're missing that the body could be having issues with. So it's very important that we find out why we're having thyroid problems, even if we've had all the tests done. Now, how many of you have been told that your lab tests are all normal, but you still don't feel right? Well, lab ranges are inaccurate. And the reason that is because they use bell curves. Bell curves were good back when we were in school, because remember, it took you from the lower end of the grade to the top end of the grade, and anybody in the middle made it through class. And the problem with bell curves is that they're not very sensitive. So what's very important now is for us to understand functional lab values, because these functional lab values are much more sensitive and they reveal the true problems. So let's talk again about this. Most of you, if you've had thyroid issues, have been given TSH. And normal lab values for TSH are like this. There's a range that goes from 0.3 all the way to 5.7. So 0.3 is on the low end of normal, and 5.7 is on the high end of normal. But the reality of that is, if you had those tests done and you fall anywhere in this range, your TSH is considered normal. Well, that's just not right. In fact, we want to fall in this functional range. This functional range is more important because that means our body is functioning like it should be. And that range is 1.8 to 3.0. So it's a much narrower range. In fact, if you're pregnant, the appropriate TSH levels for a pregnant female is 2.2. If we see a different value than that, we get nervous because it can cause issues with the baby, and there can be genetic issues as the baby is developing. So it's very important that we understand what those functional lab ranges are, and that your body is falling in this range. My favorite example is to explain children. If you're out there and you've had children, well, if you're looking at a 0.3-year-old, that's a newborn. And if you're looking at a 5.7-year-old, that's a first, maybe even second grader. Well, usually first grader. So a newborn to a first grader are 2 very different types of children, and they have different needs. So the problem is, you may be living with a 0.3 or a newborn value as your TSH, but you need a 5.7 or a first grader level for you to function properly. That's how you can feel sick, but the doctor's telling your lab ranges are normal. And that's what we see. In these areas are the lab findings that an MD would say are normal, but they're not. So this is why you can say you can feel sick, but be told that all your lab ranges are normal. And if you look at this again, were all your lab tests normals? Take for instance, glucose. Traditionally, your high-low ranges are 65 to 110. So the doctor, if you fall between the 65 to 110 range, they would tell you you're normal. The problem is a functional range is 85 to 100. That means someone with a 73 is truly hypoglycemic. They do have sugar issues, but the doctor would tell them that they're normal. Same thing like we talked about with the TSH. So if you have a 4.2, you're out of that functional or optimal range. You can look at the other tests like cholesterol, triglycerides, or even hemoglobin. The goal, again, is medicine does not recognize these subclinical presentations. But subclinical is a horrible term. People are saying they're pre-diabetic. Well, there's no such thing as pre-diabetic. It's kind of like being pregnant. There's no pre-pregnant or post-pregnant. You're just pregnant. You're either pregnant or you're not. That's what it is. So we've got to really understand these subclinical values and be aware of the functional ranges. So this is the typical tests that are ordered. If you go to your primary care or even your endocrinologist, most of them look at this TSH, that thyroid stimulating hormone. And maybe if you're lucky, they'll look at that total T4. That's that 93% that is created out of the thyroid. But remember all those other steps that we talked about in the slide before? These are those different pathways. You need to look at TSH and the T4, but don't forget about the free T3. That's the amount of total available T4, or free thyroxine. This can be affected by your medication. There's T3 uptake. How much of that T3 is actually picked up and utilized by TBG, which is a thyroid binding globulin that helps transport thyroid to the rest of the body. There's free T3. That's what's active and what the body can actually use. Now, reverse T3, the body cannot use this, and it actually slows down the process. So we may be creating too much of this, and we saw that coming from the liver. TPO and TBG antibodies, or TSH antibodies, these are both autoimmune disorders and are not truly thyroid problems. So people that have these issues may be treated for thyroid problems, but thyroid is not the primary issue. And of course, there is TBG levels. You've got to look at the thyroid binding globulin and find out if there's enough to function through the body. Now, there are a few different causes for thyroid problems. Which one do you have? Do you know which thyroid issue you have? Well, you've got to have the proper testing. That's the only way to determine what is truly the right answer. Now, there's primary hypothyroidism. There's secondary hypothyroidism due to hypopituitary issues. There's thyroid under or even over conversion. There's TBG elevation from increased estrogen, which is usually contraceptives. There is thyroid resistance. And there's autoimmune diseases like Hashimoto's or even Graves'. So there are 6 different types of hypothyroidism. Has your doctor told you which ones they're actually trying to address? Because that's important for you to understand. Now, let's go a little bit more into detail on how this works. Primary hypothyroidism, the thyroid gland gets lazy and the pituitary gland tries to kick it in the pants by pumping extra TSH. So people with a high TSH, this may be the only one that medication works for. The problem is, usually they give medication for all 6 of these types of thyroid issues. The next one is the hypothyroidism secondary to pituitary hypofunction. Well, this is when the pituitary gets lazy and you've got low TSH. This is usually from chronic stresses because it fatigues the pituitary gland, or it can be hormone pills. And that's why they talk about burning out the thyroid. If people are on Synthroid, it stops the pituitary from working. So the pituitary gets lazy. A lot of our people with estrogen creams, or even people that have been pregnant, have issues with this as their thyroid. Plus, we also see this in fluctuating insulin and glucose levels. So for our diabetics, this may be the primary cause of your hypothyroidism. The next one is thyroid under conversion. The gland is making enough T4, but there's a decrease of conversion from T4 to the active form of T3. Well, this can be all kinds of reasons. We saw all the different pathways through the liver or through the gut. So if we don't address the liver or the gut, this may be an issue for a person for forever. In fact, chronic inflammation or chronic infection or inflammation also leads to this as the primary cause. And I know many people have never been checked for that inflammation or even chronic infections. Now, thyroid overconversion and a decrease in TBG, that means there's too much T3 and there's not enough TBGs, which there's too much floating T3 around. The problem with this is it's usually insulin resistance, especially in women's. And that means the cells aren't listening to insulin, so more insulin is secreted. And when that occurs, this is when we see an increase in testosterone. So there's too much free T3 and too little of that thyroid binding globulin. So we see a lot of ladies start having hair on their chin, or they start developing masculine features because there's too much testosterone, and T3 is not getting taken into the cells and utilized like it's supposed to. We talked about thyroid binding globulin, the elevation. Sometimes there's just too much TBG in the blood, and it takes up all that free T3. A lot of times this is caused by oral contraceptives because increase in estrogen can lead to an increase in TBG. Finally, there's autoimmune disorders. Now, autoimmune disorders are very prevalent. 90% of the thyroid symptoms in the US women are usually due to an autoimmune disorder. So it's not truly a thyroid issue. It's autoimmune related. Now, Hashimoto's and Graves that people talk about, these are not thyroid problems. They are autoimmune issues. So a lot of people with Hashimoto's or Graves are being treated with medications that are tailored for the thyroid rather than fixing the underlying autoimmune disorder. So when you think about autoimmune system, it must remain in balance. So we've got the good guys, the Th1s, and the Th2s. These are the irritants in the body. So if we've got irritants in the body, we need the good guys to come and take them out. If this is in balance, your immune system does just fine. The problem is when we have those bad guys, the body can overreact. And when it overreacts, we get too much of a good thing. And the problem with that is too much of a good thing starts not only attacking the bad guys, but attacks everything else in the area. And if this doesn't get shut off, it starts attacking our glands or our joints or all kinds of other issues. And 50 to 60% of people with Hashimoto's disease have other organs being attacked. Their pancreas gets attacked and you start developing symptoms of diabetes. Their myelin or their nerve sheaths start getting attacked and people have multiple sclerosis. The brain gets attacked and we see Parkinson's, Alzheimer's, or even dementia problems. The other one is intestinal issues. So Crohn's or IBS was when the body starts attacking the intestinal system. The joints, people with rheumatoid arthritis. Next is the uterus, so people with endometriosis. We see this a lot as a bad up and down system for people that have thyroid problems, and then they have uterine problems. There's stomach issues or pernicious anemia. You're not even developing the red blood cells that can keep your body healthy. Or finally, there's the osteoporosis. The spine starts getting eaten up and thinning out, not being able to support you as you get older. So thyroid dysfunction is a sign of metabolic dysfunction. You've got to have proper testing. Now, did I emphasize that enough? Proper testing is important. In fact, we've developed a complete metabolic profile that includes this thyroid panel, including the antibodies, checking your vitamin D, your anemia, and your kidney function. Not only that, but there are immune panels that we've used to check for immune balance. Sometimes we've resorted to checking the adrenal stress index. For others, we look at food sensitivities and even stool profiles just to find out what exactly is going on with the person. So how do you get help? Well, can you predict the future of your health? This is a great question. And surprisingly, in most of my workshops, people get this wrong. The reality of this is, yes, you can predict what's going to happen in the future. If you have the correct tests and you determine the true underlying causes, you can focus on the cause and not the symptoms. There are lab tests out there today that will predict whether or not people are likely to have heart attacks or likely to have prostate cancer. We see that all the time. You just need to make sure that you order the correct tests. Now, you've got to correct the dysfunction and not alter the labs with drugs. The problem with most modern medicines is that they just give you the drugs to change the lab work. You can't alter the lab with drugs. You've got to correct the dysfunction. Otherwise, you're going to create other issues, kind of like what we saw with the Lipitor earlier in the presentation. Now, you've got to address the body as a whole. Although the thyroid is one small gland, it does affect every part of the body. So you need to be aware that one thing does affect everything else. And you've got to take a systematic approach. So the advantage with our programs is we've developed a mentoring curriculum. This basically helps you understand you so you can have the answers you need to stay healthy. Now, our goal for this is we want to tell you this information because if we tell you, some people will remember this. Now, the reality is we want to show you and they remember. Now, the final one is involve me and I will understand. Involving you is why we've developed a curriculum-based program, because with that curriculum, you become the master of your health. You see what the labs are doing. You see what steps you need to be taking, and you learn how to correct your health issues. So what we've done is created a personal lifestyle program, and that involves a complete wellness evaluation. This evaluation includes a consultation and a plan of action. Now, this consultation usually takes 30 to 45 minutes. It's worth $287. If you were to come into any of our offices, that's the the value that the doctors would charge you to go over this. On the web, we have created an online intake that you can complete, and we will spend that 30 to 45 minutes with you for an investment of only 55. That is to cover our time and to give you the start of where you need to go with the next step. Now, most people say they've already had lab testing and things like that, so the intake form will cover that. And then we can go over your plan of action of where to go next to get the answers you need. The other part of this is it's important not only for you, but if you've got spouses or family members with the same issue, we'll also go over their health profile, and that's only an additional $47 per person for that. So that is available for anyone that goes through this presentation. So what I'm going to include is I'm going to create a link that you can see. The link will allow you to click, and that way you can be part of this. And we'll follow up with you, and you can go from there.